is Alzheimer's disease? Alzheimer's is a slow-progressing and fatal type of dementia that causes loss of memory, thinking, and behavior. It is incurable and eventually leads to death. The Alzheimer's disease is a worldwide epidemic, and we have yet to find a cure. It is currently the sixth leading cause of death in the United States, and an estimated of 5.2 million Americans have Alzheimer's disease. Someone develops the disease every 68 seconds, and it affects 1 in 10 people over the age of 65. Scientists are not absolutely sure what causes cell death and tissue loss in an Alzheimer's brain, but research has supported the theory of buildup of harmful proteins in neurons. There are two different types of harmful proteins. Plaques are abnormal clusters of the protein beta amyloid that build up between nerve cells and block signaling at the synapse. The second type are tangles, which are made up of twisted strands of the protein tau. These tangles prevent nutrients and other essential supplies from moving through the cells, causing the cells to die. The plaques and tangles spread to other areas of the brain, creating 3 different stages of the disease. Over time, the brain shrinks dramatically, affecting nearly all of its functions. The disease starts in the hippocampus, the place where memories are first formed. Over time, the plaques and tangles deteriorate this part of the brain, making it harder and harder to form new memories. After that, Alzheimer's spreads to the region of the brain that processes language. This makes it tough for patients to find the right word. Next, the disease takes over the front of the brain that deals with logic and reasoning. It becomes increasingly difficult to plan things and to solve problems. Then, the part of the brain that regulates emotions is destroyed, causing patients to lose the ability to control their moods and feelings. Next, the disease moves to where the brain makes sense of what it sees, hears, and touches. In this stage, patients lose their comprehension of their senses, causing some to have hallucinations or to become paranoid. Finally, the disease spreads to the back of the brain, where plaques and tangles then erase the patient's oldest and most valuable memories. In the very last stage, Alzheimer's destroys the part of the brain that regulates breathing and the heart. This entire process, on average, takes about 8 to 10 years. There are no known causes for Alzheimer's. Scientists believe that the disease is genetic and is passed down through generations, although they have found cases in which the disease was not inherited. Many studies have also found that women have a higher risk for the disease than men. This has led to considerable research about the role of estrogen in Alzheimer's. The biggest risk factor for the disease is increased age. The likelihood of developing Alzheimer's is doubled every 5 years from the ages 65 to 85. Surprisingly, at least half the people who live past the age of 95 do not have the disease. Although there is currently no cure for the disease, there is medication that can help to slow the process. Scientists continue their quest for a cure with costly research, drug trials, and increased awareness of Alzheimer's.